it's certainly a national disgrace having 46 million uninsured people, and for the Obama administration, and for, I suspect, many of you in this room, that is the primary goal of in health reform, is to try to reduce the number of uninsured.
The practices of the insurance industry are designed so that they don't have to bear risk. They don't want to insure people who need to use medical care because that represents a loss to them.
I don't think we have a healthcare system. We really have what colleagues and I have called an illness treatment industry.
I was very angered by what was happening, but I didn't know what I could do.
We're not talking just about coverage. We're talking about coverage that's affordable but care that's comprehensive, that doesn't leave anybody out. So we have to translate that into creative ways to educate people and remind them. So for that reason, I've been wanting to focus and have been focusing more on medical students and residents to try to instill in them, to sort of inoculate them, as you will, to this idea that we need to have a truly national health program, so that rather than we taking the leadership, we actually want you to take leadership. And that's kind of the way I see myself as being a leader, by not being a leader, but by having other people pick up the ball and run with it.
You know, of all places, the public health school at Berkeley should be organizing a student movement. I felt like I was doing a bunch of complaining about, how our healthcare system is not working. And at some point, I guess I evaluated my position and I felt like, well, there's something I can do. I've got resources here. I have a little bit of time to spare. And I can find other people, like-minded people who build this with me. We had a public forum on healthcare reform on October 1st. It was called What's the Prescription for Healthcare Reform? And we had 3 faculty speakers from the School of Public Health. We staged a die-in protest or demonstration, and that involved, I think, about 60 students volunteering to lay down on the floor to symbolize the 45,000 people who die every year from lack of health insurance. Each of us has to earn our right to complain. Find something that you really believe in and find a way to get involved.
Leaders are dynamic.
Leaders are inspiring.
There's something that each of us can do, no matter how little time or money we have.
Leaders are passionate.
Leaders are ambitious.
Constantly question your teachers, constantly challenge them, as well as your peers, about whatever issue you're passionate about.
Leaders are strong.
Leaders are open-minded.
Leaders are alive.
Evaluate whether your excuses are really relevant, and whatever you can do, go ahead and do it.